Hi, it's Tom here from Running Physio. Today, I want to talk to you about a treatment option that gets discussed and I get asked about quite a lot, which is Shockwave for Achilles tendinopathy. Now, if you want to learn more about Achilles tendinopathy, we do have a great free video series available for you. I've put a link there in the title to access that. We've also got videos on iliotibial band syndrome, lateral hip pain, lots of other options for you to check out. Now, with tendinopathy, we know, unfortunately, not all tendon pain settles as we'd expect it to. It can be slow to recover. Even sometimes when people do everything right, it seems to be something that takes time to get better. And because I've done research in tendinopathy, particularly proximal hamstring, I see a lot of patients with persistent tendon pain. And because they've tried hard for a long time, they want to think about what are the other options available to them. And one of the ones that comes up again and again is Shockwave. So I thought it would be good to talk to you about this and look at some new research with some quite impressive results for Shockwave and talk about when it might be appropriate for our patients and how perhaps we might integrate it within everything else. Now, I've mentioned in the title that there's been some new research with quite impressive results for Shockwave for Achilles tendinopathy. So I think that's a good place to start. Now, this research is from Abdel-Kader et al. It was published in 2021 and is a double-blind randomized controlled trial assessing Shockwave for Achilles tendinopathy for non-insertional, so mid-portion Achilles pain, which is probably the most common for us to see in clinic. Now, they recruited people who had persistent tendon pain and they had tried conservative treatments already without success. And I think that's quite useful because that's quite often a group of people that I would see. And they've randomized them then into two groups. Now, both groups received a rehab program, which was eccentric loading combined with stretches for the calf and the hamstring. But the study group, in addition to this loading program, also received Shockwave. I believe they had it once a week for 4 weeks, so 4 sessions altogether. And the control group just did the exercises. Now, it's a relatively short intervention, just a 4-week intervention, which is quite short, really, especially for a loading program, which usually use about 12 weeks in most studies. And then their main outcomes then were Visa A, which is a really good questionnaire, probably one of the best outcome measures for Achilles pain, and also pain during activity scored on the visual analog scale. So let's have a quick look at some of the results that they got then. Now, as I said, some of these are quite surprising. So I've taken the results from Abdel-Kader et al. and stuck them in a little graph for you. The top graph here, we have the study group in blue. So this is a group that did eccentrics and also had a course of shockwave therapy, and the control group that just did the eccentrics and stretches in green. Now we see at baseline they all score pretty high for that pain score, so they're all getting 8 out of 10. But post-treatment, which is about 4 weeks later, there is a massive reduction in the study group from 8 to 1 out of 10. That is a big reduction, with the control group only seeing a small reduction in pain. So that is quite an impressive result. Now, the follow-up then was done sometime later, between 13 and 18 months. On average, about 16 months later, they followed them up. And you can see again the control group that's just done the eccentrics and stretches. They've continued to improve, but the shockwave group is still ahead. While they're not quite as good as they were immediately post-treatment, they're still pain scores of 3, significantly less than they were initially at baseline of 8. So from that point of view, that seems to be a very impressive change, particularly in a short period of time. Now, if we look at the graph beneath that, this is looking at Visa A. So looking at this Achilles outcome score that we have, which scores out of 100. So 100 would be the best score. Now, at baseline, both groups tested pretty low, so 24 in the study group, 21 in the control group. And post-treatment, both groups have got a significant improvement, particularly the group that have had shockwave alongside their eccentrics and stretches. They've increased to 85. That's a really dramatic increase in a short period of time. Now, again, at follow-up, roughly about 16 months later, so long-term follow-up for this, the study group that's had the shockwave and eccentrics has retained good scores in their Visa A, as has the eccentric group. They've improved as well, but they've not quite caught up with the group that had shockwave and eccentrics as well. So, this study then has concluded, similar to some previous research, that we're going to get the best results with Shockwave if we combine it with some kind of rehab option. In this case, with eccentrics and with stretches as well. And it seems to get results quite quickly in this study, and then those results are pretty well maintained up to 16 months later, which is a pretty impressive result. Now, as with any research, we need to be aware of some of the limitations potentially with these studies, and I'd like to see this replicated in other work, because when we look at some other research, their results aren't quite as impressive as this. I'd also be interested to see what happens with return to sport. It's not really discussed here. So are these people getting back to their full function? That is something that Visa looks at, but of course we know for a lot of people, once you take away their aggravating factors, symptoms do settle. So often it's a big question, has this person got back to the level they want to? Would be interested to see what the objective markers in terms of things like strength, the plyometric function are as well, because I would wonder if a short 4-week loading program would really address calf strength deficits, which we know do exist with Achilles pain, and whether they address the plyometrics deficits and actually get people back to the running and other sports, of course, that they may want to do. So I think this is encouraging research. It's interesting. It builds on other research, which does suggest we're going to get the best results if we combine Shockwave with other forms of treatment. So the question is then, what can we take home from this and the available research that there is on Shockwave for tendinopathy? Well, I would say point one is that let's not rush straight into Shockwave as an option, because a lot of people will do quite well without it. And also clinically, I have seen cases where it really has flared people up. So like this study has done, I would recommend rehabbing people for at least about 3 months and working with your key rehab strategies, education to help them understand the pain, load management for them to bring the aggravating activities to a manageable level, and then progressive rehab. My bias, I personally prefer more heavy, slow resistance training because I find it better to address their strength needs and combine that with a graded return to their goal activities as well. That's so important. Just the strength work and loading program on its own is okay, but really what people come to see us for is often they want to get back to the sport that they love. So we want to integrate that alongside. Now, if you're really not seeing improvements around about that 3-month, 12-week stage, if it's really not shifting with all the right management in place, you feel the person understands it, they've followed the advice quite well, that's the point where we might think, okay, here's where Shockwave could be an option to see if we can help improve pain and function like we've seen happen in this study. But bear in mind too, and with some of the latest research, we see that psychosocial factors are a big piece of the puzzle for people with Achilles pain. There's new research showing that seems to be the case in roughly about 40% of people with Achilles pain, where pain catastrophizing and fear of movement may be a factor. So I think, again, we want to make sure those are addressed in that early phase of rehab. So discuss those in the early sessions rather than further down the line. So I think Shockwave can work, but it isn't for me. There's not quite enough evidence there yet for me to want to rush for it to be the first-line treatment. There are cost implications involved for the patient. There's difficulty accessing it for some people, and occasionally it does flare things up. So I would go with our loading and education, etc., as I've discussed first. We also might want to consider other options with evidence. Things like a simple heel lift in the shoe. There's recent research that shows that can help with Achilles tendinopathy. So there's often less costly, simpler measures that we might want to try first. And also, if we are going to go down that Shockwave route, make sure we're addressing rehab needs. And that would be one question mark about this study with the short loading program. Is it really addressing their rehab needs? Is it getting them stronger? Is it improving their plyometric capacity and their load tolerance? So if you choose to do some Shockwave, just try and make sure we're assessing and addressing their rehab needs. Now, the final thing that this study also does, which I think is quite intriguing, is it raises a little question. What about stretching? Now, traditionally, for some time, we've stopped stretching for tendinopathy, particularly insertional, because it tends to aggravate it. And there's some sort of top 10 articles on things not to do for tendinopathies, and often in there is stretching. Now, interestingly enough, this study seems to get very good results and included stretching for the calf and the hamstrings as part of that 4-week program. So I'm going to put that out to you listening into this. What do you think? Have we dismissed stretching for tendinopathy? Could studies like this suggest that maybe we need to think about that again? Because combined with eccentrics and Shockwave, it did seem to get good results here. Again, my view is I think probably the stretching is going to have quite short-term results. We want to make sure that it is mid-portion and not insertional if we're going to bring that in. And it's not my priority in terms of addressing people's rehab needs. But if it gets symptomatic relief for people, I think there can be a role from it. But I'd like to hear from you. What do you think? I mean, sometimes we throw these treatments out a little bit prematurely. Perhaps that's the case. So let us know in the replies and comments whether you think that we should include stretching and what you think about Shockwave. Do you think it's really helpful? Or is it one of those things that's being kind of overhyped at the moment? Okay, so I hope you found this helpful. In a nutshell, asking the question, can Shockwave be effective for Achilles tendinopathy? I would say yes, there is evidence it can be effective. It's not going to work for everyone, and you're going to get best results if you combine it with the right rehab program, the right load management, help someone understand it. But if you've got persistent tendon pain that isn't improving after a good 3 or 4 months of good rehab, it is an option to consider and discuss with your patient. Okay, thanks again for listening. Bye for now.